everyone. My name is Erica Swery, and I am the Head of Engagement at Women as One. On behalf of our team, we send our support and well wishes to our entire community around the world. Your work inspires us every day. We will each experience the pandemic differently, so gathering an understanding of the full spectrum of resources available to support us is important. We at Women as One felt it would be particularly critical to discuss the impact of trauma on our well-being, both during and after the pandemic. We are pleased to host an all-star, all-female panel of trauma experts to help guide us through the underpinnings of traumatic stress, explore how stress uniquely impacts women, and discuss what we can best do to support ourselves and each other. I'd like to start off by having our panel introduce ourselves to our audience. Can you give us a brief background and let us know about your current role? And Tara, let's start with you.
Sure, and thank you for having us, Erica. This is really important work, and we're glad to be a part of it. I am Tara Galovski. I am the director of the Women's Health Sciences Division of one of the VA's Center for Excellence, the National Center for PTSD, and also an associate professor in the Department of Psychiatry at Boston University. And I also direct the Women Veterans Network, which is how our paths crossed. Mm-hmm. And that's a network that's designed to really foster social support and connections for women after separating from service. And my primary area of research is to develop interventions for post-traumatic stress disorder.
Great, thanks, Tara. Patricia, can you introduce yourself?
Sure. Hi, everyone. I'm Patricia Watson. I work at the National Center for Post-Traumatic Stress Disorder. I'm a clinical psychologist. My primary focus over the years has been on trying to develop materials for people who are working in many different settings, but often related to disasters or ongoing public health crises, that type of thing. And prior to this job, I was a clinical psychologist in the Navy, working with adults and then working with children and families. So I've always been really passionate about trying to make materials that are practical, that, digest research and get it on the ground, because I know how busy people are in the jobs they're doing.
Thanks, Patricia. Sonya?
Hi, I'm Sonya Norman. I'm also a clinical psychologist. I direct the PTSD consultation program for the National Center for PTSD, and our mission is to help clinicians have the tools they need to treat veterans with PTSD, which includes consultations, lectures, any resources that could be helpful. And I'm also a professor of psychiatry at the University of California, San Diego School of Medicine, and my research is in treating results of trauma such as guilt and shame and moral injury, and also PTSD with co-occurring substance use disorder.
Great, thanks. And finally, Deb.
Thank you so much for letting me come and talk to you all today. I'm a clinical psychologist as well. I'm a professor at Stanford University in the Psychiatry and Behavioral Sciences Department. And I am also currently the president of the International Society of Traumatic Stress Studies. And I do work with the National Centers for PTSD as well. And in terms of my own research, much of my research is focused on how do we get care to people who have trouble accessing it, both including sexual and gender minorities, ethnic minorities, underserved communities, both within and outside of the US.
Wow, this is quite the panel. We're really lucky and thankful to have all of you today. So maybe we can just start off with a bit of the basics. And can you summarize different types of immediate reactions to trauma and which reactions might indicate a need to seek additional resources? And maybe Patricia, you could kind of guide us a bit on that.
Sure. What we found, especially in disaster settings, is that immediately you tend to see different types of reactions. Cognitively, you see reactions such as, intrusive thoughts or worrying. Self-blame is common, ruminating is common, trouble just making decisions and having confusion. So in the cognitive domain, you tend to see these reactions are common, but we also know that one of the issues that happens in disasters is everyone focuses on the potential negative reactions, and there can also be a full range of reactions, including people feeling more resolve and determination. Some people have sharper perception and intuition in that moment, and courage is common. Optimism, being inspired by others is another common cognitive sort of reaction. We also see physiological things, and again, a full range from fatigue and headache and muscle aches and pains, trouble sleeping, nausea even for some people. But we also see in the positive side, alertness, readiness to respond. Sometimes people get an adrenaline rush and increased energy. Within emotional domain, again, full range. Sometimes people go numb and are in a bit of shock. Other people have grief, sorrow, sadness. Some people feel guilt because they're not handling things as well as they wanted to. Anger and irritability is also common for people, and fear. But, on the positive side, we see people wanting to get more involved and seeing this as a positive challenge, and it mobilizes them. We also see people with a lot of gratitude, trying to focus on the fact that there are things they have to be grateful for. And lastly, in the social domain, lots of changes with people. We can see people get more withdrawn and isolated because they're just trying to contain and handle things on their own. We see sometimes people feel more numb towards others because they're overwhelmed. Also, we see increases, as many of you know, in interpersonal conflict and that type of thing. And then on the flip side, we see people being more altruistically involved and trying to connect with those that are in their community or people who need help. Some people reconfirm their values and their priorities, and they realize that they appreciate their family and friends much more. So again, wide range of reactions. A lot of it has to do with risk factors, and mostly it's how exposed people are to the event or the trauma that's happening to them.
Yeah, I really appreciate you talking about the positives. I think that that's such an important point, and one that gets, I think, overlooked a lot. So thank you for that. It's really great. Tara, you and I kind of talked about this before, but can there be a delay in your reaction to trauma? So let's say you have a traumatic event happen to you, you go back to work, you go on with your daily life, and then 6 months later, you start feeling off. Does that ever happen? And maybe, Deb, you can kind of walk us through that.
Tara, you want to take first stab at it, or shall I?
Sure. Go ahead, Deb.
All right. I love what Patricia was saying in terms of these early reactions. This range of reactions is so normal. It's part of why we don't talk about diagnosing PTSD in that initial wave of symptoms or reactions. If somebody is still having these kinds of reactions and they're pretty intense, they're interfering with their functioning, they're not really getting a whole lot better, say a month, 2, 3 months down the road, then it may be a sign to take note and think about maybe reaching out for some help or getting some additional support.
Makes sense.
Yeah. Tara, what do you want to add?
Yeah, I agree. And I think sometimes, particularly in these really high stress situations and just the chaos, Eric, I know we spoke about likening this kind of situation to really almost a war theater in many ways. And our healthcare providers and our first responders are on the front line. And so oftentimes in that moment, in the interim, it's really mission focused, and that really can grab your attention. And then as things kind of start to settle down, which hopefully they will soon, then I think this can hit you in this delayed response way that you and that Deb just described. So I agree. So even if if there's something to be said for symptoms that persist over time or elevated distress that persists over time, but sometimes you can think you're doing pretty well and you are doing pretty well, and then it can just hit you later. So it's something to be aware of.
Absolutely. Yeah. I think especially as people come out over the surge in the places that are being hit the hardest, there may be a time where people can take stock of how they're doing, and that may be when they really start to process the impact of this.
Yeah. So Terry, you kind of mentioned this a little bit about, fighting COVID is like fighting a war. Is there anything that healthcare workers can learn from the veteran community? And then a specific question about gender differences. So are there differences in the way that women react to experiences than men?
Yeah, it's a great question. And I think that one thing that really reaches out and grabs my attention in looking at that parallel between our medical professionals and our women soldiers and service members, and certainly in the veteran community, is that, when women are lower numbers in many of these professions, and those low base rates, they create these unique circumstances, and often unique challenges go along with those unique circumstances. Reward too, for sure. But one of the challenges is that sometimes I know our veterans, and I would imagine some of our medical professionals, really feel like they have to work triple hard to get to that place. And so there's a lot of perceived risk that's inherent in asking for help. But it can be, that can really increase isolation. It can increase loneliness. And so if you're feeling stressed and distressed, and then feeling as if you can't reach out to your colleagues and to other people that are sharing that experience, then that genuinely can complicate that experience. There's other kinds of unique challenges that women face, like women are often the primary caregivers. And so all of the burden that's experienced at home certainly can also complicate, your ability to focus on your job at hand, and then to kind of decompress from that stress afterward.
Yeah, that's really excellent. And then Sonya, I think you might have a bit to add talking about moral injury and guilt. Can you add to this discussion as well?
Sure. One of the things that we see service members really struggle with sometimes is if during their service they were in situations where there was no right way out, right? No matter what they did, the outcome was bad. They were put in really difficult situations where maybe they felt like they had to go against their values or their morals. And I think there's a lot of parallels now with what healthcare workers are dealing with. You do your best at work, but does that mean that you risk bringing the virus home, right? It's like living your values in one area might jeopardize your values in another area. And what we've seen with veterans is that living with these kinds of choices, even when there was no right answer and there was no way to save the day, can be extremely difficult. And I think a lot of our healthcare workers are facing various situations where they might feel some guilt about what they did or what they couldn't do. And so I think it's something that we need to watch for and be prepared to help. And for now, while they're kind of in the thick of it, just colleague support and being able to communicate with colleagues and knowing that they're not alone can be very helpful.
Yeah, I mean, I think all of those points are really important. I think that the having no good options and also working triple hard, I think is going to resonate very much for female cardiologists around the world. So those are just really excellent points. So with respect to COVID-19 related exposure specifically, and our frontline workers around the globe, what advice do you have for decreasing stress during this crisis? And maybe Patricia, can start with you.
Yeah, this is a big question. And we've been trying to talk about this and think about this in a number of different ways. So I won't do it justice in the amount of time that we have here, but I'll try to give a bit of an overview. So there are a few things to think about. There's a really wonderful writer that I've liked named Dave Snowden, who talks about complexity theory. And the reason why what I like about his model is that he acknowledges that the model's called the Cynefin framework, but he acknowledges that under normal circumstances, when we're all doing our jobs, there's a certain way to do it that usually is based on best practice, because times are predictable, relationships amongst things are more controllable. When you introduce a public health crisis into any system, a home system or a work system, the way of doing things has to adjust as well. And part of what really needs to adjust is immediately you have to establish, more control and order, which means sometimes you have to be very specific about things, being done a certain way. But as time goes by, and I think we're all seeing this, there's a need to have better communication, more frequent communication, so that people are checking in with each other and saying, okay, what's working now? What's not working? We really have to be talking about this amongst everyone and trying to figure out, strategies. We have to try things out and not be afraid if they fail, try out different ways of doing things and continue to get feedback from each other so we can move forward. A lot of times it involves bringing experts in, but sometimes we're doing things on the fly. The dance is different. The steps are different. And if people don't make those adjustments, then it can be a problem. One of the adjustments socially and emotionally is the mantra that I've heard people use is, none of us are at our best right now. None of us are at our best right now. So that means we have to be patient, we have to be kind with each other more than normal, and we have to make allowances that no one's going to be doing their top game right now. We're all juggling a lot right now. So within the Cynefin framework, they also say that it's very important to think theoretically about frameworks that might be helpful for people right now, because those frameworks allow for flexibility. If you try to just impose, well, everybody should be doing this and everybody should be doing that, it's not going to fit for everybody. So the framework that we've used a lot is this 5 elements that we discovered as we were looking at situations of ongoing threat. We had an expert panel. We talked about, what do we think works for people? We looked at the research and we came up with these 5 elements that seem to be related to better recovery in situations of ongoing adversity. And so we have developed a lot of our materials around these elements because we know that people can take that framework and be very flexible in the way they apply it at home, at work, depending on what's happening. So the 5 elements are to move towards a better sense of safety, to find ways to calm people or systems, to get social connection, to help people feel like they can get through a situation with what's termed self-efficacy, that they feel like they either have the resources or the ability to make their way through it. And lastly, hope is the last element. So hope can be optimism. Hope can be a person feeling like they have the resources they need. Hope can be faith or religion or some sort of values framework that a person uses. And we found that if you have safety, calming, social connectedness, self-efficacy, and hope, people tend to do better, no matter what system or situation they're in. They don't have to have all 5. They can have 1 or a few of them. And it tends to, vary depending on the person's situation and their personality and what's going on for them. So I like the flexibility of the framework. What we found is that, for instance, social support has to be modified. Some of us are introverts, so we don't want to say everyone needs a lot of social support because that's not going to appeal to everyone. But what it means is that if social support is right for you, then you have to find the way that it makes the most sense. For some people, it's pets. For some people, it's just that one person. But I have found that in ongoing situations like this, you have to figure out whether your existing social skills are going to work for you, because many of us, especially women, are the go-to people in their life. So others come to them and they now have a set of social skills that they haven't had to use very often, that they have to now figure out, how do I talk to the people in my life I'm closest with and say, you know what, I don't usually ask for help, but I'm going to maybe need help in a different way now than I typically do. Maybe you work out the framework, which is, I just need to vent to you 5 minutes of the day. I don't want you to fix it, but I need that 5 minutes, whatever it is for you. You have to figure out what's going to make the most sense for you. Maybe you also figure out that you're a person who it isn't through social support. For you, it's through something physical. It's through stretching or, yoga, or sitting in your massage chair, or, for you, it might be more emotional, where you have to listen to a song that allows you to have emotions flow, or you have to watch a movie that allows, each person's going to be different. And so the idea is to try to set up a menu for yourself. What's going to work for me on particular days when the stress is super high, and then maybe on other days I will do different things. And just start to set those plans for yourself, and maybe work with the people who are in your life to say, look, all of us are going through a difficult time. How can I help you? Let's figure out ways that I can do that for you. And just set those in place and allow them to change as time goes by. But I think authenticity is particularly important right now, where I've seen it in my own life. My husband was trying so hard to protect me from his stress that he was just acting weird, and I didn't know why. And so I was getting irritable with him when I finally said to him, just tell me what's going on, and then together we can figure it out. Then that worked better. So we all have to just acknowledge that we can't always protect each other. We just do the best we can and figure out things that are going to work for us. So I'll stop. I know
that was wonderful. I think I might stitch "We're not at our best right now" on a pillow to remind myself, because it's really important. Tara, is there anything what you want to add to what Patricia said, particularly on some of the social pieces to that?
I mean, Patricia just nails it every time. It's just words of true wisdom, and always makes me feel better listening to her. So hopefully that will be helpful for others. You know, just to echo being kind to yourself, and I think experimenting a little bit. You know, one thing, you know, social connection, whatever that might be, is so important. I think, especially when you're feeling lonely in a contrived way. You know, so if you are the only woman on the front line, if you're the only woman experiences and you want to connect but feel like you can't because of the situation, then being kind of thoughtful about where you can put that and who you can kind of lay that burden down for that 5-minute rant. And that's something that that the women veterans have really taught us, is that it's a little bit of a leap of faith to make those connections with somebody that has walked that path with you. But they found that it's been incredibly helpful. You know, it doesn't necessarily need to be another woman, but someone that you can trust in taking a little bit of a risk and saying, hey, can we just decompress about this day today, or something like that, may feel pretty daunting, but it may be really, really valuable. So that's just something that we've learned from our kind of social support network.
Great. This was excellent advice, and I'm going to record it. This is recorded, so I'm going to play this back several times. This is a wonderful part of the conversation. So how about decreasing the delayed stress reactions that were described earlier? And maybe Sonya, you can talk a little bit about this.
Sure. You know, for some people going through traumatic situations like the ones we've been discussing can lead to, you know, mental health problems down the road, like depression, like post-traumatic stress disorder, other things. And, you know, for many people, some support from loved ones or maybe a therapist just to talk to might be enough. But it is really good if someone's still struggling, you know, in 3, 6, 12 months to talk to someone to see if they have a diagnosable disorder, because if you do, then there are evidence-based treatments that are really effective. And I'm sure I'm speaking to the choir when I'm speaking to a group of cardiologists to say you do want the evidence-based treatment. Mm-hmm. You know, they're highly effective, more so than just a talk therapy, or, you know, and there are effective medications as well. You know, sometimes the psychotherapies have actually kind of more lasting results we've seen in research for both PTSD and depression and some of the other common things, but they're both really good options. Some people choose both. So I would just encourage anyone, if you're still feeling really like the distress is a very big part of your life a few months after this is over, it's not getting better on its own, it's disrupting your quality of life, your ability to function in your many roles, do talk to a mental health professional or your physician, and do look for an evidence-based treatment.
Great. Yes, evidence-based is going to be a very, I think, respected thing for our audience here. Deb, is there anything cross-culturally you'd want to add to this?
So, in terms, I'm going to riff off of Sonya's comment around evidence-based interventions. First of all, the risk of PTSD is not necessarily evenly distributed cross-culturally, and that's true from the early reports we're seeing with COVID-19 as well. So, for example, when people have high rates of stigma, so for example, in communities where having COVID-19 is then associated with people pulling away from you, there does seem to be more risk around mental health consequences. You can think about how that might intersect with people's race or ethnicity, for example, within the US or outside of the US. In terms of our interventions, the good news is that most of the research on cross-cultural adaptations to those therapies that Sonya was just talking about has found that they're quite robust. They seem to work well for people all over the globe, sometimes with some adaptation to make them a better fit for people. But the good news is we do have treatments that are really brief and that are highly effective.
Great. And I think the global impact too is really important since our audience is global. So it's really excellent. So there are a lot of resources online and articles as it relates to stress and trauma. How do you sift through all these resources? And Deb, I'm going to kick it back to you again.
Yeah, absolutely. It's one of those places where right now it feels a little bit like trying to drink from a fire hose. There's so much content coming out, and it's hard to know, like, where do I go for information that's accurate or information that's digestible? And there are a couple of different places that you can think about. And some of us have tried to do some of the work for you to get it out to you. So one of the places that you can go is ISTSS, which is the International Society for Traumatic Stress Studies. And I'm going to actually point you, let's see if I can do screen sharing successfully. There is a piece where you can say how many PhDs does it take to be able to screen share on Zoom.
There we go.
So this just shows you briefly our resources. I want to point you to two pieces that I think are helpful. So we actually have pulled together for people COVID-19 specific resources from all over the web, and we have vetted the resources that they are at least reasonably accurate and are good resources. Okay. And so if you go there, what you can see, some of this information is actually specifically geared towards providers who are trying to learn good skills, but some of the resources are geared towards what can I know, right? So what might help me in coping? The other piece is Sonya recommended or referred to the idea of evidence-based interventions. But if you're a cardiologist, you may not know what the evidence-based interventions are for PTSD. And so I am going to point you to, now it's a good test to see how fast I can find it, are evidence-based interventions for PTSD. And so if you're wondering what medications might work or what kind of psychotherapy do I want, if you go to our website, you can find our prevention and treatment guidelines. And we actually have all of the recommendations, both for the acute phase and then the chronic phase, of what we have found. There's a research base that supports that it's likely to work. And that's open access. You don't need to be a member to get to it. We want these resources to be available for anyone who's looking for help.
Great. Excellent. And then Sonya, I think you had a couple of resources that you'd want to share with us as well.
Yes, let me get to those as well. So I'm going to just give you a quick walkthrough of the National Center for PTSD COVID-19 resource page. A quick way to get to it is just NCPTD, or National Center for PTSD COVID-19. And we are still in the process of developing materials kind of as things unfold to help people have the tools they need. And we've divided what we've developed so far, and I have to give a shout out to Patricia, who has taken the lead on many, if not probably most or all of these. We have resources for the general public. So If physicians want to share this with anyone in their lives, with their patients, this is really helpful. And also, of course, for themselves. And then for healthcare workers and responders. So this is both for helping tools for yourself as well as for those who are running teams and, kind of caring for colleagues. And then employers and community leaders, this is really where, those who are taking care of others comes into play. And so for each of these are all based on kind of established evidence-informed models, and they're all really approachable and kind of digestible materials. They go through a lot of vetting with a lot of editing to make sure that they're really clear and as simple as possible. So we also, if someone does want to just learn more about PTSD, you can see on the left here, there's a lot about for yourself, for family members, just understanding what it is, what are the evidence-based treatments. So hopefully easy to navigate and easy to find these things. We also just in the last week or two released an app called COVID Coach, and it's kind of a self-help tool to help folks just manage the day-to-day stress that they're experiencing right now that might be related to COVID-19. That's downloadable right now in the App Store, and it'll be available for non-Apple phones shortly as well. But it's free. I highly recommend it.
Yeah, I actually downloaded it. It's awesome. And so we're going to have a link to it and with this recording, because I think it's just a really great resource for folks. So thanks, Deb and Sonya. So this has been an awesome conversation. And I have one final question. How can we best support our frontline colleagues, friends, and relatives during this time of crisis? Patricia, I'm going to have you answer this because you're just the greatest.
Very nice. So, I mean, a lot of it is, as I said, just finding ways to really ask questions or pay attention to the things that might be affecting them the most at this time. A lot of it is learning to check in with them regularly, pay attention to signs that they might not even be aware of in themselves, where they're, acting differently or just more quiet. And then some of it is using your own knowledge of that person to figure out for yourself, okay, what do I know is helpful for this person? I know they're not a talker, so how am I going to support them in another way, or something like that. But you can also, please feel free, as I said, to approach and say, look, I know you're having a lot on your plate right now. How can I support you? I can look up things online that would be most helpful for our family in terms of safety, in terms of calming, in terms of, trying to get social support amongst our family and our friends. I can, try to figure out things at home and take things off your plate so that you don't have to worry about those things. And it's really a dance, as I said, because everyone's going to be dealing with their own specific experience. But I think if you keep this framework of, what am I doing to help this person feel safe? What am I doing to help calm them? What am I doing to help them feel social support? What am I doing to help them feel like they've got the tools they need to get through this? And what am I doing to help them have hope or confidence? If you ask those questions, I think you're probably going to be able to find a way that works for you in your circumstances.
Great. I think that's a wonderful note to end on. And just thank you guys so much. This is just such an incredible conversation. I think would be really helpful for our Women as One community. So I want to end by saying to our Women as One community that we see you, we're here for you, and we thank you so much for your incredible bravery. We're all in this together. Thank you guys again. It's really great.